Good afternoon. I'm Dr. Duke Majan with the Duke Spine Institute. Our patient is originally from New Jersey, now in Florida, correct? And he's here with chronic back pain. He's had back pain for 8 years. When I asked him where his pain was, it was here in the lower back where he has 2 herniated discs, L34, L45, and here in his buttock, and here where he has his facet joints at L434, L45, L5S1. So we're going to be treating his discs, his facets, and his piriformis. We're going to split this up into 3 different streams. We're going to start with his disc repair. And Henry, let's share with our audience the 30 different causes of chronic lower back pain that people get. I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L45, followed by L5S1, then L34. The L12 and L23 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L12, L23, L34, L45, and L5S1. The most common facet joints to cause chronic back pain are L45, followed by L5S1, followed by L34, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, touches the vertebral bodies. With trauma, can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. Welcome back. You can see from our video that there are 30 specific causes of chronic back pain. Chronic back pain means back pain that has been present for that patient for more than 6 weeks. We don't really treat acute back pain. Acute back pain, if you say get into a car accident and have a fracture and the back pain starts right after the fracture and it's lasting a few days, that's acute back pain. We treat it as a profession, but Duke Spine Institute doesn't treat it. We're not an emergency room. We don't see car accident patients that come in out of the car off the highway. But those patients go to the emergency room. Their pain is treated by the emergency room doctor. Usually they're admitted to the hospital and they're going to have pain management manage their pain. But patients with acute pain, that is pain lasting less than, say, a week, those patients are not the ones we're most interested in treating. We're interested in treating patients with chronic back pain. And our data that you just saw in the video is based on patients with back pain that lasts longer than 6 weeks. Now, those types of patients have back pain that comes from different places than, say, a patient with acute back pain. Chronic back pain patients have back pain that comes from things like their discs, their facet joints, their SI joint, and their piriformis muscle, and sometimes their bony spine, which can have a fracture. The most common reason for patients to have back pain that's chronic, lasting more than 6 weeks, either constant or intermittent, is going to be a tear in the back of the disc called a posterior annular tear, where there's inflammation. And that is what this patient here has. He has 2 discs that are damaged or torn, and he has back pain originating from L3-4 disc herniation and L4-5 disc herniation. So 2 discs causing his back pain. We're fixing those discs right now with what's called the Duke laser disc repair. Now, Henry, for those who have never seen our video on the Duke laser disc repair, let's show the audience how this surgery actually works.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. Luis and I were just talking about the laser here, and for those of you who have never seen lasers working in medicine, this is a medical laser, meaning it's a laser machine that is designed specifically for medical purposes. And the machine itself is quite large. It's on wheels. It weighs about 350 pounds. And Luis could bench press it with one hand, I'm sure. But the machine is very big, very heavy. It requires 110 energy, 110 plug, right? Yep. 110 volts. Yep. So it plugs into a normal 110 outlet, and it generates a very powerful beam of laser energy, which I'm using right now on this piece of herniation. And the reason why we use the laser, because when you put the grabber in, the metal grabber you're seeing right now, it'll grab and grab and grab, but often you cannot get the herniation to come out with the grabber because the herniation is actually stuck down to the wall of the tear. And what sticks it down there is something called scar tissue. The reason there's scar tissue is the herniations cause the body to respond to the herniation, a process called inflammation. So your body is actually trying to heal that tear in the wall, but it can't because the herniation is there blocking it. So what happens is all that healing process or inflammation causes scar tissue to build up over time, which then causes the pieces of herniation to get scarred to the wall. And when I go in there to take them out, or any surgeon, they don't come out because they're scarred there to the wall, and those metal instruments, they don't work. They can't generate enough force to grab onto the herniation and pull it out. Okay, so we use a laser instead. The laser is extremely precise, and the laser will break up the scar tissue that's holding the herniations into the disc, preventing them from coming out. The laser will actually free them up so that I can then go back with the grabber and take them out. Like this piece right here, right? See that? I just freed it up with the laser fiber. Now I'm going to put the grabber back in, and I'm going to grab it, and look how easy it comes out. That's because I freed it up with the laser. I freed it up from the surrounding disc annulus that it was scarred down to from all that inflammation. Once again, we're the first in the world to do this type of surgery. I'm the pioneer of the surgery, hence it's called the Duke Laser Disc Repair, named after me, named after my company where it was pioneered. Any question?
At this moment, no current questions.
All right, another piece of herniation. Again, for those of you who watch these surgeries often, you know that a herniated disc is not just one herniation. I've told you that. You can see that. It's obvious. It's many, many pieces. And the average is around 40 pieces of herniation. And this patient is no exception. They have an awful lot of pieces. Every time I reach down and grab, there's more little pieces that you're seeing that will come up. And then we have this constant stream of saline that is cold and sterile, and it's literally pushing all these pieces up and out of the disc and here onto the operative field. That's what we call the area that I'm operating. All right, any questions? There's the tear right there. You guys see it? And there's some inflammation.
Yes, we do.
So I'm at the most superficial part of the tear right now. I'm at the end of the tear, the part that's on the outside of the disc. We've been on the inside tear. Once again, using the laser to break up the scar tissue you're seeing right here. This is scar tissue. It's holding the pieces of herniation in place, not letting them go, not letting them be free. So taking herniations out is not easy. They don't just pop out. You know, you don't just put a tube down here and they just come out. They're stuck right here. You see them stuck down? And I have to use a lot of laser energy to free them up.
We have a question
Sure.
coming from Lanu on YouTube.
Hi, Lanu. What do you want to know about today? The cost of the air conditioning system? I'm just kidding with you, Lanu. I hope you appreciate. I'm joking.
Speaking of jokes, Lanu asks, have you ever think about becoming a comedian? It's rare to see a laughing doctor.
Ha! I thought I was a comedian. The neurosurgery is just the sidekick, the side act. My wife always tells me you should stop laughing at your own jokes.
My wife says the same thing.
Right?
Yeah.
I think that's just something that women say to men all the time. I think I'm very funny, but my wife doesn't laugh, and she tells me I shouldn't laugh at my own jokes. But I think I'm funny, so I'm going to keep laughing.
Wise men told me there's nothing wrong with laughing at your own jokes, so
Right?
I second that.
Nothing
yeah.
wrong with that. And they say laughter is the best medicine. And honestly, sometimes if I'm not laughing, I would be crying. So I have to laugh so I don't cry. Thank you, Lanu. I appreciate it. I think I am funny too. And I think it just takes a certain type of person to see the humor. Okay, here, this is the end of the disc, and now we're just outside the disc. That's fat. Somebody asked me, I think it was Scott or maybe it was Jeff, who was asking about, could you use the laser to get rid of fat? Yes, you
that
can.
was Scott, yes.
Maybe it was Scott. There's fat right there. I just got rid of it with the laser. But the problem is this looks big to you, but it's actually very small. Remember, the laser fiber is 1 millimeter, so I just zapped away 1 millimeter of fat. That's not a lot of fat. I think there are much better tools than this laser right here for removing fat. All right, there's a piece of herniation. You guys see it right there?
Yes, we do.
Okay, so I freed it up. I got rid of the scar tissue that was shackling it, holding it, and now I'm going to go grab it and pull it out. And that's really what this surgery is. We call it a debridement. It's just a series of going in and using both the laser and the grabber to take all these pieces of herniation out. There's just lots of pieces that are... All right, any other questions?
At this moment, no current questions.
Well, let's show the audience how the Duke laser disc repair works one more time. Just
Copy that?
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
from our video there, you can see how the laser is used to clean up the tear in the back of the disc where the herniation comes out. Right here, what I'm working on right now, the blue stuff, that is herniation. I'm zapping it away with the laser. I'm releasing it from the scar tissue, holding it to the tear so that the tear will now heal itself. But the tear is not able to heal itself without first using the laser to remove the herniation and scar tissue that's stuck inside the tear. You can see more fat now. We're going to leave that fat alone. I'm happy with what we've done so far. And you can see we've removed all the inflammation. We've removed the scar tissue. We've removed a lot of pieces of herniation. And what you're left with now is basically normal disc plus tear that will seal itself off in the next few months and close up and heal itself. That's why we call it the Duke laser disc repair, because the laser is used to clean up the tear so that the disc can repair. The laser will clean the tear so the disc can repair. How do you like that? All right, Henry, since we showed everybody how the laser works, let's show people why discs become so painful when they get injured.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. So now you can see how discs do get injured through trauma. Trauma is the underlying cause of all pain in the body that's not related to tumor or infection. Trauma causes fractures, trauma causes tears of ligaments, capsules of joints. Trauma is the common denominator of all back pain and neck pain, except that caused by tumors and infections. So tumors and infections account for less than 1% of all chronic back pain and neck pain. So trauma accounts for about 99% of all back and neck pain that's chronic. 99% is traumatic. And the trauma causes primarily an injury to the disc by tearing the wall of the disc and allowing the jelly that's being held inside the middle of the disc to fragment into little pieces, and then those pieces start to squeeze out through the tear. And as they work their way out the tear, they get stuck in the tear, causing inflammation, and then the inflammation in turn scars those little pieces into the tear, and so that they can't get out of the tear no matter what. They just get stuck in the tear, and they cause more inflammation. So it's kind of like the old movies where the guy gets grabbed by three guys and then one guy starts punching him while the other guys start holding him. The poor guy getting punched is the herniation. He's getting beaten up by the inflammation and just stuck there. It can't get away. That's causing horrible pain in your back. Duke Spine Institute, we discovered this. We were the first in the world to discover it. There's been studies that show that back pain is related to inflammation, but nobody ever figured out the inflammation was in the posterior annulus and that it was caused by the nucleus, and that inflammation was causing the pain nerves to be activated, and those pain nerves travel up to your brain, to an area of the brain called the primary somatosensory cortex, which is somatotopically organized for pain and sensation, fine discriminative touch. Obviously, this is not fine discriminative touch, it's pain. So pain and fine touch and proprioception all go to your primary somatosensory cortex. So it's somatotopically organized, meaning that you know exactly where that pain's coming from. It's your lower back. So it's very specific pain, and most doctors don't understand the mechanism of how it works. We discovered it at Duke Spine Institute 20 years ago, and I have been teaching people about it since then, and I have been treating it since then successfully. Here's a piece of herniation, and that's a big one. Take a look at this one, Hen. So we got a nice big piece of herniation out already. You guys see that?
Yes, we do.
Let's put the tape measure up. And there it is. You can see It's about 2 centimeters long and about 1 centimeter wide. So that was our first piece of herniation coming out. Let's go get some more. Any questions?
At this moment, no current questions.
All right, we're going to be done with this disc surgery, Duke laser disc repair, in about 10 minutes. And thanks. And then we're going to switch over to fixing this patient's facet joints. He happens to have facet joint pain on the right side at L4-5 and L5-S1. He's got bad arthritis of the facet joints. You can see it on the x-ray. Sclerosis, enlargement of the facets, indicating an old injury that his body has responded to. All right, getting back into the tear. Here we go. What a mess, huh? Look at that. Totally disrupted. Now normally this would be nice white fibers coming across in an organized fashion, just like your shirt has cotton fibers that are straight, even with some crisscross, but it's a nice pattern that's consistent. Ah, come on. All right, any questions?
At this moment, no current questions.
Let's show the audience how we treat facet joint pain at Duke Spine Institute.
Of course.
We pioneered the first permanent treatment for facet joint pain called the Duke plasma rhizotomy. Thanks.
For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK, 349-6922. Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Duke plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK, 349-6922.
All right, welcome back. You can see facet joints get injured through trauma, just like the disc. And instead of herniating, they don't herniate at all. They actually just don't heal. And they end up becoming inflamed, lots of inflammation. And that inflammation causes horrible pain. I know we have a question, so I'll take it.
We have a comment and a question. This comment is coming from Sherry on Facebook,
Hi, Sherry. Welcome to our live stream.
saying, I don't have a question, but a concern. I have been evaluated by Dr. Duke. At that time, my symptoms were not as bad as they are now. I have had several injections. No one wants to help, but they want to put a stimulator in, and I refuse. My symptoms now are severe pain going down my left leg to my foot, pain in right leg down to the backside of my calf. It is very hard to cough or sneeze or even laugh. I'm getting fed up. I've had a couple of accidents since I've talked with Dr. Duke. I have fallen on my rear with a horse going on top of me.
Oh, no.
I can't come down there because of my insurance. United Healthcare, John Deere, Premier doesn't cover, and I just don't have the cash laying around for your treatment.
Yeah. Well, I'm so sorry to hear you're suffering still. And eventually we're going to sue United Healthcare for not covering our treatments, but we have to get Blue Cross Blue Shield first. So you can wait if you can, or maybe you want to talk to me again and see if you would be a candidate to talk to our attorney, and maybe we can do something to try to get a decision that your surgery should be covered by your insurance if they're not going to cover it. So that is possible. That's what I would do if I were you. If you don't have the money to pay for the surgery here at Duke Spine, then I would meet with your scheduler, tell them you want to look into the attorney option and see if we can get a judgment in the court that the judge will decide they have to cover your surgery, because that is an option. The other option is running with the bulls. And what I mean by that is having some other surgeon operate on you and having potentially horrible complications, right? I don't know what else to tell you. I'm so sorry. You know, United Healthcare is the largest commercial insurer in the world. It's second to Medicare, but Medicare is not commercial, it's federal. And United Healthcare is so rich, they make billions of dollars a year in profits by denying people's treatments like yours. And that's wrong. It should be illegal. It should be criminal. But it's not, because they write the laws. United Healthcare basically paid off your politicians. And I'm ashamed to say that insurance companies have paid off and bought even the governor of Florida, Ron DeSantis. Ron DeSantis is no friend of doctors. Ron DeSantis signed into law new laws that basically let the insurance companies underpay doctors and facilities so that we can't afford to treat patients anymore. That's on the work comp side. So doctors no longer can afford to treat work comp patients because of the new laws that Ron DeSantis signed into place. So he's a Republican. It goes to show you that how corrupt our politicians are. And that law that was signed into place was done without any input from me and my surgery center, and we treat work comp patients all the time. They basically cut the payments down to nothing. So politicians are doing the dirty work of the insurance companies by writing laws that allow the insurance companies to not pay for surgery or treatment. And they're doing this behind everybody's back, and people don't know about it. People don't know about it. And I'm telling you about it. But other doctors won't tell you about it because they don't even know what's really happening. They're just clueless. The economics of healthcare are so complicated that 99% of doctors don't understand them at all. They just think that healthcare is too expensive, which it is in America, but they don't understand why. And the answer was because the insurance companies are not paying the hospitals and doctors properly for the care that their beneficiaries are getting. So we don't make enough money, we go out of business, and that's what's happening. It's very complicated, but it's very easy for me to understand. I'm sorry that your insurance is giving you the runaround, but if you're interested in the option of having a judge decide, you have to talk to your scheduler who was assigned to you and see if we can do that. I know that's going to be an option soon. I just don't know if it's currently available. I wish I could pay for everybody's surgery myself out of my own pocket, but I can't afford to. All right, we're done with this stream. We're going to bring you back in a few minutes for the Duke plasma rhizotomy of the facet.